subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors Today. We are in the midst of some indifferent weather today. On the field, of course, the Indians are playing a little precariously and dangerously, if I might say. But weather-wise, we have inclement weather in my new home city of Pune, and where Dr. Bhat is also there. It was raining quite heavily. In Mumbai as well, where I am today, it has been raining. And before I introduce Dr. Bhat, good evening. How are you? Doctor, you're on mute. You're on mute.
Very good evening.
Good evening.
I'm good. How are you all?
We are fine, thank you. We have a interesting and a very active community of senior citizens who would be joining in for this webinar. But before we start with the webinar, I would love to introduce Dr. Bhat over here. Dr. Bhat is a senior consultant in glaucoma, cataract, and medical retina at the Chelarans Hospital, which is well known for its diabetes care and as a multi-specialty hospital in Pune. She completed her MS in ophthalmology from Christian Medical College, Vellore, and worked as a consultant at the Giridhar Eye Institute after her medical retina fellowship. She has published extensively in the field of glaucoma with several publications in leading journals, including the American Journal of Ophthalmology and the Journal of Glaucoma in the US and Retina. She has contributed articles on diabetes and books. She has won the Best Research Paper Awards at the national and state levels on 5 occasions, including the Best Neuro-Ophthalmology Research Paper at the national level in January 2000, and the prestigious Shiva Reddy Research Award in the year 2009. Dr. Bhat regularly takes part in lectures, instruction courses, and workshops at both the national and regional levels. Her paper was accepted for presentation in the Asia Pacific Association of Ophthalmology in 2015. She has participated in the World Glaucoma Congress in 2021 and the Asia Pacific Glaucoma Congress in 2021. Dr. Bhat has also participated in multinational clinical trials in ophthalmology. She has also participated in several multinational clinical trials in ophthalmology, as well as several research work across over the years. Thank you once again, Dr. Bhat, for being here. And,
Thank you so much.
I know you've been doing some heavy duty work, if I might use the word colloquially, about glaucoma, etc. And today we've asked you to speak about conjunctivitis, infections, and eye care for seniors. But this is the season for conjunctivitis, so to say. And we just thought it would be good to have somebody as senior as yourself to talk about it and to talk about how senior citizens can help ward it off. And if they do, God forbid, do contract it, then what they can do for it. So, Doctor, over to you for your presentation. And we will, as always, take questions from our readers and viewers over here. And those of you who have questions, please put them down in the Q&A tab. You can mention your age and gender. We will, of course, first priority will be to questions on conjunctivitis. But since we have a doctor as qualified as Dr. Bhat over here, if you do have some questions on glaucoma and other issues about eye care, we will also put them in, but at the end. Over to you, Dr. Bhat.
Thank you so much for your very kind introduction. And it's an absolute pleasure to be here. And I would like to give my presentation in the initial 10 to 15 minutes and then possibly take questions on both infections and, if possible, on other eye diseases as well. Thank you so much for having me over.
Yeah, our pleasure, Doctor. Would you like to share the screen?
Yes, sure. This topic is on conjunctivitis, infections, and eye care for the seniors. So how do we recognize a infected eye or a conjunctivitis? So the eye, all of us are very familiar with this. It will be red, or as they say, pink eye. And there'll be a discharge especially nowadays, we see more of viral conjunctivitis as against the bacterial one, which used to spread very widely, and it used to, go off very easily. But nowadays, because it's an antibiotic era, we see more of viral infections, which have more of watery discharge rather than the yellow or yellowish white discharge. So the eyes are typically sticky when they get up in the morning, and they do say that the eyes were all stuck up, the lashes were stuck up, and we literally had to wash our eyes before we could open them. Generally, that doesn't happen. When your eyes open in the morning, you just gently open them, but you can actually feel the heaviness in the eye or a sticky discharge as if somebody has taken glue and stuck them together. So that is a very common and a very typical symptom that we get in conjunctivitis. Also, we get some swollen eyes. We have to distinguish this from a swollen eye gland, which I will deal with later on. There will be some blurriness of vision if the conjunctivitis is not appropriately treated on time with antibiotics or antiviral ointments. And we find the eyes so swollen that we look like Chinese people with all swollen eye lids, both the upper lid and the lower lid, and we can barely see through those slits. So this can also happen when the conjunctivitis is spread and it has not been treated for a couple of days. Now, what exactly is conjunctivitis? We all aware that our eyelid, the way the eye appears is we have the top eyelid, the lower eyelid, and we have a white coating of the eye and a black coating. On top of the white coating, we have a transparent layer, which is not normally visible. When it gets infected, it is visible. It becomes pink or red. Now, that can get infected and vulnerable because of viral infections, bacterial, or even allergic infections, allergic conjunctivitis. Now, how does it spread? It usually spreads if you touch an infected person's eye and you self-inoculate or you rub your eyes with an infected hand. It can spread with air. The earlier variety, which was bacterial, it used to very easily spread from one person to the other. So people used to don dark glasses or a black glasses so the air contact is minimized. Any tear fluid, for obvious reasons, if you're having discharge in the eye, the same discharge carries those viral bacterial particles, and that can infect another person. So we call it fomite spread. That is, if you have an infected person touching articles such as pen, paper, or very commonly nowadays in the era of gadgets, we have mouse which is touched by the infected person. The same mouse in an office scenario, if it is touched by another person, that person can again touch his eyes with the infection, and he can inoculate or he can put all those bacteria into his eyes. So anybody in a scenario of working with you has a red eye, you suspect an infection, he has a teary eye or a red eye or eyes with discharge, please send him home, give him a mandatory leave and let him go home and treat it and then come back. So that's a way to, these are some of the ways to prevent an eye flu. How do we do it? We have to wash our hands before we touch our own eyes. Frequently sanitize eyes. I usually tell my patients that it's very easy to follow these norms because we are all aware for the past 2 years we have been doing only this. How to prevent corona? We all know it very well and we do it very often. Sanitize the eyes. Even now we find sanitization bottles all over the place. So it's easy to prevent flu in those scenarios, and we are aware of doing these preventive measures. So, like I already told you, if there is an infected person in your office or at your home taking care of the elderly, you must give them 1 or 2 days leave so that you don't suffer that infection. So do not use articles or share articles with persons who have been infected. Do not share pillows or sheets, which normally happens. And use dark glasses as far as possible if the infection is very severe or people who are vulnerable. And use tissue as against recyclable cloths or handkerchiefs or towels. during the time that the person is having infection. The reason being, these tissues which are infected or used by the person can be easily discarded, whereas cloths and other articles go into the washing machine and again start. You don't know that the virus is actually killed by your washing. So that is about the conjunctivitis. It could be virus, bacteria, more commonly virus. The variety of virus that we get is adenovirus. And once we get these eye infections, sometimes we also get throat infections or vice versa. The person can have throat infection. It can go on to the eyes, because the eyes, there are channels just next to your nose which drain into the throat. So if you have a throat infection which is viral, those pores can get blocked, and sometimes they can percolate to your eyes. So the eye infections and the throat infections are usually connected or common. After going on to the eye surface infection, which is called conjunctivitis, we will now deal with another kind of common eye infection, which is a eye stye. You can see these small bumpy areas on the lid as seen in this figure. This is called a stye, a hordeolum in medical terms. And this is also a variety of infection which we commonly encounter. This infection is pertaining to the eyelid margin because of there are several glands on the eyelid margin which are placed exactly perpendicular to the eyelash margin. So these glands usually outpour oil glands which protect the tear film which is placed on the surface of the eye. Now, these oil gland ducts can get blocked, it can get infected, and because it has got blocked, the secretion usually tends to stagnate inside the eyelid margin itself. This is extremely painful, and it's like somebody has taken a pin and is poking your eyelid margin. In this case, it has to be recognized as against the eye infection per se. This usually happens in patients who are diabetics or who have a change in the eyeglass power, especially the cylindrical power. We have two kinds of power, spherical and cylindrical. If you have a change in the cylindrical power, you can get recurrent stye. We often get children with recurrent conditions, and this kind of stye can get infected because of gram-positive bacteria. If you have this kind of a condition, it requires to be treated with antibiotics, drops, and more often fomentation. That is the key way of getting this infection and swelling down. Once that is done, his eyeglass power requires to be corrected, and then it gets treated. This condition usually occurs in patients who are elderly or who are diabetics as well. Now, I talked about there are glands on the eyelid margin. The first picture on top shows you these transparent areas which are perpendicular to the eyelid margin. I hope you can see that on the image. And these are the glands placement on both the upper lid and the lower lid. If these glands do not function properly, they are called meibomian gland dysfunction, MGD. We may find doctor's notes which just says an abbreviation MGD, which means meibomian gland dysfunction or meibomitis, or inflammation, infection of the meibomian gland. This is a very common cause of infection, and it happens because the meibomian gland ducts are getting infected or are not functioning properly. And in the second picture, in the lower end, you can see these tiny yellow dots on the eyelid margin. These are the meibomian gland openings on the eyelid margin, and they are not secreting properly. Therefore, you have these bumpy fluid pockets over there. This is a very common cause of watery eyes in the elderly or irritating eyes in the elderly. And lots of our patients, most of, you can say even 90% of our outpatient department deals with this condition. It is not very easily recognized, one. Second, it's more of a nuisance value. However much you treat it, however well you treat it, it seems to persist. The reason being the treatment for this is usually taking care and taking good care of the eyelid margin, which involves fomentation for 10 minutes in the morning, 10 minutes at night. So the elderly usually get fed up of it. So one must remember that watery, itchy eyes are not something which you need to bother too much about. You require to use lubricants and maybe a fomentation which requires to be continued for a while. The eyelid margins can get so infected and the lid skin is likely to get affected and even abraded, like you can see in the second picture. You can also observe in the second picture down that the eyelashes are also affected and they are devoid or denuded of the eyelash. This happens when the eyelid margin skin gets infected, and this condition is called blepharitis. Blephara means the eyelid, skin of the eyelid. It can get infected in two varieties. One is called a squamous blepharitis, where dandruff-like scaling of the eyelid skin margin can occur. And the second variety is a little more sinister. It can cause ulcer formation, yellow crusting can happen, and it requires more attention and may take a little more time for it to get treated. However, both these conditions are treatable and they do well. You require to take good care of the eyelid skin margins because the skin over here is very tender and soft. The infections in the eye can percolate and it need not be restricted to the outer portion of the eye only or the lid margins only. It can go on to the surface of the eye and you can have more sinister infections. Infections on the top black area, I would say, is actually the top area has a transparent layer. I would just like to show you on a 3D model, otherwise it's not very easily understood. This is a model of the eye. It is an exaggerated model of the eye. Obviously, this may not even fit, this may possibly fit an elephant, not our eyes. So this is how the cross-section of the eye appears. This, if you can assume, this is the upper lid, this is the lower lid, this is the white portion. We were talking about eye flu. Another layer over here on top of the eye white layer is a transparent layer which gets infected in the eye flu. Now we are dealing with this black portion, which is not really black, but there is another. If you can see very clearly over here, there is a transparent layer. This is the black of the eye. So I'm talking about an infection which affects over here. That is the cornea, which I have shown over here on the slide. That is the cornea. This portion can also get infected. The eye flu is a layer which is present on the white coat of the eye, which is transparent. That is the area which gets infected on the for conjunctivitis or eye flu, not the white, a layer on top of it. So these infections which take place on the surface top portion over here are called keratitis or corneal ulcers, and different kinds of organisms can infect. Bacteria, virus, protozoa, acanthamoeba, very common in diabetics. I wanted to show this because if you do not take good care in patients who have diabetes, which is very common in elderly, you can get these kind of infections, not to scare you, but just to make you aware of it. So I'm done with my small presentation on infections as such. I would like to take any questions if you want me to present regarding the different parts of the eye and then take up questions. That's also fine.
Doctor, go ahead with the entire presentation and then we'll take all questions.
Yeah, so I have kept it very brief over here because I did not know how much time we were having. So I'll just explain the structure of the eye. Is it visible or should I bring it closer?
No, it's visible. It's visible, doctor.
Yeah, so.
Yeah, now it's visible.
Can I continue?
Yeah, please go ahead.
Yeah, so I did not know who all were interested in which part of the eye. So I'll just make my presentation of parts of the eye, and then we can deal with the different kinds of diseases that we encounter commonly inside the eye. So I already gave a brief introduction about the structure of the eye. This is a closer view of the model, which is more easy to understand rather than the presentation. This is the upper lid, assuming this is the lower lid. This is the white, and this is the black of the eye. Now, if you make a cross section, the black has a canopy-like layer. This is the black of the eye. There is a cap-like transparent layer called the cornea. Now, this is the rubber band-like portion, which can move in and you can expand it and you can have a better view of the inside of the eye. This transparent lens is a biconvex lens. If it loses transparency because of age and other factors, trauma, or even in diabetes, you can lose the transparency of this portion called the lens, and that is what gives rise to cataract or motivindu. Inside the eye, you can see a red layer that is called the retina or the camera film-like layer of the eye. Between the lens and the retina, there is no gap. There is a jelly-like transparent layer over here, which fills up the space. It's a watery jelly. Now, the entire globe of the eye is connected to the brain by means of this nerve. This entire eye is connected by means of a nerve called the optic nerve. So how does the eye function? We view a pen. The image of the pen goes in through this area, which is called the pupil. It passes through the lens. It forms an image onto our retina. And the retinal image is carried on to the brain. And the brain tells us which color of the pen it is, what is the size of the pen. Perception occurs in the brain. Reception of the image occurs inside the eye. So that's about the eye. Now, there are various very common diseases in the eye. One is, like most of you are aware, cataract, which is loss of transparency of this portion. So this is the lens. If you lose transparency, it can be graded. So if you lose transparency of the eye completely, then you can't see, nor can I see into this eye. So that is when you require a cataract surgery. Even if it is graded, you are not able to see, your vision doesn't improve, we can still do a cataract surgery. We need not wait till the dead end or till the cataract completely opacifies. The second disease is called the glaucoma, or glaucoma is a little difficult concept to understand because people are not aware that similar to the blood pressure inside the body, which everybody knows should be 120/80, there is a certain eye pressure to maintain the shape and function of the eye. So in order to maintain the shape and this function of the eye, which it carries on throughout your lives, there is a certain pressure which is maintained, and that pressure is said to be 10 to 21 millimeters of mercury. So if that pressure is not maintained and the pressure goes statistically higher than 21, it reaches 25, 26, it tends to damage the nerves which are connected to the brain. Initially, you may not realize how much the damage is. Once your doctor takes a peek at the appearance of this nerve, he may realize. Second, if he notes a higher pressure, he may suspect that there is a glaucoma in your eye. And this can bring about an irreversible damage without the person actually feeling it. If you have diabetes or blood pressure, you can actually make out certain disturbances in your body. But unlike that, in glaucoma, which is a pressure-related disease of the eye, the person may not actually feel any problem or sense any problem in his vision initially. Therefore, it is mandatory to check your eye pressures every now and then. And if it is suspicious, the doctor himself will tell you how often to come for a checkup. Last but not the least, this is a layer of the eye which is very important. It senses light. It is a camera film-like layer. There are nearly 1 to 2.5 million cells in this small area. I am holding a enlarged version or an eye model, but this small area is actually 2.5 to 3 millimeters. Within that is bunched up around 2 to 3 million cells or receptors. So this is called the retina, which receives image through which we see the entire world and which makes our world so beautiful. It is important to take care of this retina. How do we take care of it? So we have conditions like very common conditions in this era, like diabetes, blood pressure. So these diseases can impact the eye. So diseases like diabetes, every year the person should come and check his retina for to know whether there are any diabetes related changes in the eye, which is called diabetic retinopathy. Blood pressure again can cause some diseases inside the eye. It can block your blood vessels and cause loss of vision. So that also should be taken care. And if you have blood pressure or diabetes, one should check their eyes. Third, if you are aged, the age itself, like you have graying of the hair, you also have aging of the eye, and age related diseases inside the eye are also common. They are of two varieties, dry and wet, and these can affect your vision and can hinder your daily activities. So that's my brief presentation, and now I'm ready to take questions.
Thank you very much, Doctor, for the presentation. We have quite a few questions that have come in. But let me take this one, which is Mr. Anand Kumar Chopra talks about his wife who's 69. She's suffering from MGD, no secretion, and she has been advised warm water fermentation. Right eye gets smaller. He wants advice.
So the MGD, sometimes the secretions become so thick that it does not come out when you put gentle pressures or you do fermentation. The way to do fermentation also, there is a technique to do it. You have to place warm cotton balls in warm water, keep it for 10 minutes on the closed lid, and then gently press in the direction of the meibomian gland. Simply keeping the fermentation and just removing it. Whatever you are fermenting, again, after a while, once the warmth goes away, it again hardens in the same place. So I'm not sure what you've been advised and what you're actually doing, but I'll just briefly summarize what we usually advise the patient, and you can possibly follow that. So you take a little bit of warm water, do not add any salt or anything to the solution. Take cotton pieces and do not take cloth, because that can abrade your skin, which is very tender, which I mentioned during the presentation. And squeeze out the excess water from the cotton ball and just keep it on the closed eyelid. Once you do that, after 2 minutes, the warmth of lukewarm water, the warmth will completely go away. Again, dip it back in your warm water container, squeeze out the excess water and place it back over there. So once you do that for 10 minutes, it has received adequate fermentation. Once you do that, look up, gently press on the lower lid, and do that simultaneously to the entire margin from this end to this end. Similarly, to the upper lid, you can do it with placing your fingertip like this. It should be perpendicular to the eyelash margin. Then only after you have fermented, the liquid from the meibomian gland actually melts. And if you press it in the direction of the gland, it actually comes out. Otherwise, if you're simply fermenting and just applying the drops, that will not help because you're not healing the eyelid margin. The secretions need to come out. The eyelid is small. You just mentioned that the eyelid is small. The eyelid is small and heavy because the secretions are still stagnated inside the eyelid margin. Right. You have to also place ointment onto the eyelid margin. Rest of it, possibly your doctor locally can help you.
You know, before we go on further, I must advise that I normally do every time is that the advice that we give to all of you in these sessions is purely advisory. You know, whenever
Right.
you require, you must visit a doctor,
Yes.
get a clinical examination. Of course, all our doctors, including Dr. Bhat, are available for a teleconsult, and Dr. Bhat, Dr. Savita Bhat will be available via Chelaram's, and the website is there. Dr. Bhat, before we go further, there's a question from Mr. Lakshmi Narayan, who's 68. He wants to know as to when can we declare a person totally clear of conjunctivitis. Normally, people would like to get back to normal work, normal life, even when they are 80% clear. And I also understand that when the thing is on its way out, someone else catches it. Is it therefore, is there a way to avoid the spread with some indication of 100% normalcy?
Yeah, so there are, so generally when we give drops, we usually ask them to put it for 2 weeks, but it is not that the person can take off for 2 weeks. So these, just like common cold, it can have a varied span of disease. So generally, if the eye is not pink or the person does not have any ropey discharge or even sticky eyes, he can get back to work. So there is no standardization because the viral diseases especially has different strains and it mutates very easily, like we have seen in the corona viruses. So this is more prone to mutations. So generally, if the eye is not red and does not have any discharge, he can go back to work. These are not very sinister. So if the person is in incubation period, he's just contacted the disease and he is using the common articles which are placed, he can usually infect 1 or 2 people. That does happen.
Right. Thank you. Doctor, we have a question from Mr. Prakash Jatiani, who asks, I have watery eyes. Please suggest a medicine.
Well, this will require the reason for the watery eye. I can't be prescribing medicines just based on symptoms. So I'll require to examine and then go ahead. Watery eyes can also occur if you do not have the appropriately checked and placed glasses. So if your glass power is inappropriate, it can still produce watery eyes. It need not be a diseased eye.
Right. So, Mr. Jatiani, you must, you need to get to Pune to meet Dr. Bhat or
Not really. You have ophthalmologists everywhere. They are, I think, in excess, I would say.
Doctor, we have a question from Jayanti S. I know you have, in a sense, addressed these questions, but since there are quite a few of them which have come in, the question is eye irritation, reddishness, pus on eyelids and eye corners. Is it conjunctivitis? Will Ciplox drops be of help? And what is the dosage?
The first part of the question is irritation to the eyelid margin. Like I already mentioned during my presentation, the skin of and in and around your eyes are extremely soft. They are loose and they're very sensitive. So if the eyelid margins have to be inspected first, whether there is any crusting, any infection, which I already mentioned, stye or anything of that sort. If that is not there, the eyelid margins are just perfectly all right, then all you require is a lubricant. If the lash is not infected or the eyelid skin is not infected, all you require is a lubricant. Now, generally, the eye ball is covered from the upper portion and the lower portion. So the exposed areas are the corners, which are more exposed, especially when you are driving on a bike or a two-wheeler, which is very common. So the gush of air tends to hit over there, and usually the corners are always itchy and dry. The second part, I'm sorry, I didn't get it. There was a second part to the question.
Yeah, the second part of the question was, is there a way to spread? Sorry, I'll come to the question later, but I've missed what. I think I've deleted it.
Yes.
Doctor, there's another question from Ms. Jaiswar Das, who asks, why do people wear dark glasses and glares when they have conjunctivitis? I know you made a mention of that. I've had
Yes, I did make a mention, and that is Mr. Jayasurya Das. I can see that. Thank you very much for being here. And the what is the ideal age to start eye preventive
eye
checkups?
checkups.
That was the first question, or that was the
That was the
second
first,
question?
first part of the question. And the second question I asked was, which is
Yeah,
about
so okay. So
conjunctivitis.
why do people wear dark glasses? The earlier conjunctivitis, which was very common, was bacterial conjunctivitis, and it used to spread very commonly with air. The current era of antibiotic, which I again mentioned during my presentation, is viral conjunctivitis, which usually spreads by fomite, which I mentioned. Those are articles which have been used by people who are infected. And if you have inoculated the same infection into your eye by touching the articles which are commonly touched by those people. So the concept of wearing dark glasses came because they used to think that it was by air spread, and bacterial conjunctivitis did spread by air. Therefore, that concept came. But nowadays, we don't find it very common, and the viral conjunctivitis are less virulent, I would say, that is spread less unless you actually rub it into your eyes by touching or rubbing or spreading in other ways.
Doctor,
So,
perhaps because sometimes, like for instance, your presentation was on, and I felt a little itchy in my eyes. So it often happens that when you see a red eye, you start feeling itchy yourself.
no, not really. Not really. We have been examining red eyes throughout the season, and I don't think we actually felt itchy.
The other question, sorry to get back to the earlier question, was will Ciplox drops be of help, and what is the dosage?
Ciplox is again antibiotic which is commonly used. It can be of help, but there is no preventive drops. I forgot to mention that in my presentation. Very often, people who come as bystanders of a person who has got or contacted eye flu, they ask us, give us also some drops so that we can prevent it from getting it into our eyes. So there are no preventive measures, preventive eye drops, I would say. For you can't put any antibiotic before you get conjunctivitis. There is no such concept. If you get it, you put the eye drops. But in order not to get it, you have to take preventive measures, like which I mentioned earlier. Use the no touch technique and do not touch your eyes, do not rub your eyes, sanitize your eyes, and wash them frequently. Those are the techniques which you need to follow for prevention. You cannot use some eye drops to prevent infections.
For all of you over here, Dr. Bhatt's presentation will be available on the Seniors Today website on Monday with the takeaways as we normally do. So you can have a look at that. Doctor, there's a question from Mr. Mukherjee, Mr. N.K. Mukherjee. Since many years, I rub my eyes daily, which gives a relaxation. Is there any medicine that he should take?
He should be on a lubricant. The reason why he feels like rubbing the eyes is because the eyes are dry and itchy. So he requires to use any standard carboxymethyl drops, which are 0.5% or 1%. If he's alone, he can use a 1% solution, which requires to be instilled less frequently. But if he has people around, a 0.5% solution used more frequently will give him more relief, at least initially. So there are several brands which are available in the market. Refresh Tears, Gentile, any of these standard brands are good enough.
Right. Thank you, Doctor. We have a question which is from Mr. Apurva Mehta. And, there are quite a few questions on cataract, but this question is interesting. And he is 80 years old. And his question is, and Doctor, you would be impressed about the fact that, Mr. Apurva Mehta, 80, and they are so active on Zoom. And it's amazing as to how our senior citizens, have embraced technology. And when we started with our health webinars in 2019, we weren't very sure. I personally was not very sure whether we would be having questions from our senior citizens. And I obviously underestimated, them. And it is amazing. So that's what Dr. Bhatt, Mr. Apurva Mehta, he's a senior citizen in 80th year. His question is, when should a cataract surgery be done? And what if it is delayed? Are there any harmful effects?
Yeah, so we usually tend to advise our patients to do the cataract surgery when it is hindering their daily activities. Now, considering daily activities, it is different for each person. A person staying in a village who is doing agricultural activities, you have standardization of this vision, which is standardized based on the number of letters they read on our testing values, which are called Snellen charts. So if that person in a village is unable to see at 6 meters, he may still be all right. He may not want to do a cataract surgery. The same thing if a person with a similar kind of vision staying in an urbanized city and working with computers, or even Mr. Apurva Mehta, if he is not able to see the Zoom, he will not be happy about it because he is not able to do his daily activities. So in that case, that person requires a cataract surgery, whereas a person in the village can still delay it. Now, the common problem, why this, Mr. Mehta, thank you for asking that question, because the common myth around delaying cataract surgery is, especially in the part of the country where I stay, that is Maharashtra, people usually think that the cataract can grow, it can balloon out, it can burst, and it can result in another disease called glaucoma. That is just one variety of glaucoma. Not every cataract ends up becoming a complication. So you should not indefinitely delay a cataract surgery till you're cataract blind and you're still delaying it. That's not correct. Now, in olden days, what used to happen is the ladies in any household, they would get one eye cataract surgery done. Whereas because they have so many, they have to run the entire household, they would delay the other eye surgery eternally until the cataract matures or it bursts or it has gone into complications. They would not get the other eye done for want of money, also for want of time, and for prioritization, because they can see with the eye which has been operated, so they are not bothered about the other eye. So those kind of indefinite delay till you're getting it complicated should not occur. But as long as you can function and you can see and you can read very clearly, that's not a problem. Now, very often with cataracts which occur with age, you can see for distance with a small minus power, but your reading is hindered because the cataract generally tends to hamper your reading. So we speak to the patients what their activities are. Now, there are young patients who are diabetics who get cataracts on the back surface of the lens. This is the entire lens which I already showed you. You can get cataract which are pertaining to the back surface, and it will exactly hinder the vision from the center. So these kind of cataract which impair over here on the back will produce scattering of light, and those individuals will not be able to drive at night, especially when they go driving at night. They'll find the glare from the vehicles coming in front very annoying and disturbing. So they will not be able to do their daily activities, and that is when we advise them. There are ways, medical ways of assessing who requires, who does not require. Of course, there is quantifying these visions and talking to them, and then taking appropriate steps and telling them.
Doctor, we've almost crossed our deadline, and I know we are holding you from patients, and we don't want to stop that. But doctor, we would of course request you to come once again, because there are quite a few questions which have been asked on glaucoma, and there will be questions on cataract as well, which will be there. So while we have taken down all the questions, sorry all of you for not being able to address all your questions to Dr. Bhat. But one last question which is there is, and I'm sure a lot of people want to ask that, is what are a few exercises that everyone must do for overall eye health? Is there one or two things that...
There are no physical exercises. The way you can take care of your eyes and prevent disease is one, regular checkup. Wherever you are, definitely go for an annual checkup. And if you do find out that there is cataract or glaucoma, just listen to what the doctor is saying. What is the stage of glaucoma? Glaucoma is very easily treated if found out early. You require only eye drops and regular 6 monthly to annual checking of the side vision which gets affected in glaucoma. Second, if you're a diabetic, definitely undergo a retinal examination. If you have cataract, it is completely reversible. So don't get scared of cataract, which is the common myth that cataract we should not get. But cataract is easily treated. And nowadays, it's very simple to follow cataract surgery because it is sutureless and easily done everywhere in the country. So cataract is not scary. You can do it at the time which is convenient. Don't hinder yourself. Don't make it hinder your daily activities. Get it done before it starts bothering you. That is my message. And if you have age-related macular degeneration, there are two varieties, dry and wet. We require to figure out which variety you have, and you require to come for follow-ups. That's about it, about briefly on the eyes. And for eye infections, I've already given you a protocol how to prevent it. And they are not very sinister, dangerous, so nothing scary. Even if you encounter it, it is just a matter of 2 to 3 days and you'll be off it.
Doctor, what about those exercises that, one hears about like this and, these kind
So
of things?
those are not recommended for everybody. That is why I meant exercises in the sense I did not go in for that exercise. Those are only for people who have weakness of convergence. They are only done for particular patients, not for everybody. Even those people who go, they see all 9 directions, they are not meant for everybody. That is not going to help in any way. The eye muscles are anyway well innervated. One eye muscle is innervated in the sense it is connected to one eye nerve. So they are very strong. You can't make it stronger. You require to make your skeletal muscles stronger by doing morning walks or evening walks or whatever. The eye muscles cannot be made stronger. They require to be made stronger only when they are not functioning properly or they are paralyzed, or people who have squint or strabismus, or they have deficiency in bringing the eyes together. Those people require these push-up exercises, not for everybody.
What are two very quick questions, but I know a lot of people want answers to these. Getting an eye checkup at an optician, is it yes or no?
If you have just, not for the elderly, beyond 40, you require to go to an ophthalmologist. Before 40, due to lack of time, if you want to go for a quick eyeglasses, yes, it can be recommended. Beyond 40, an annual eye checkup is recommended.
And the second thing is that there are quite a few of these camps that are happening for eye checkups, and there are 150 cataract surgeries happening in a camp, etc. Are these camps, can you trust them? Is it fine to go to them?
The eye cam surgeries are nowadays generally done at a hospital setting with a proper operation theater. The local setup of camps, which used to occur very often earlier, they used to just fumigate, sanitize a particular room and do the eye surgeries. Those have largely stopped, I would say. In remote villages, it still may be happening in India, but largely people don't do it because you get a lot of infections, and the infections can result in blindness and loss of the eye. So because people are worried about these infections and they are not reversible as against infections elsewhere in the body, where you can give higher antibiotics and more antibiotics and recover and heal the area. The eye, especially after a cataract surgery, if it gets infected, it is very difficult to heal it or bring back the vision.
Right. Thank you very much, Dr. Bhat, for taking time out on a Saturday evening. I know eye infections are in the air, and I'm sure you have a host of patients waiting for you. Thank you once again. We are going to come to you once again for being on our sessions, because there are so many questions and there's such a fantastic review which we have got, feedback that we have got on your session. So to you, Dr. Bhat, and to the Chelaram Hospital for facilitating this, thank you very much. All of you there, we will be back once again next Saturday at 5 p.m., our regular time for Health Life at Seniors Today. Those of you who aren't aware, the takeaways and the edited video will be put up on our website on Mondays of the session that we've just watched of Dr. Bhat, as well as all the sessions that we've had over the last year and over the last three and a half years. They'll all be there on the website, which you can review. And uh, if you haven't done that already, you can pre-register for all our sessions, and the registration link was put up on the chat window. So you can do that, and of course you can subscribe to our newsletter. You can read our magazine, all the 50 issues of the magazine that have been published so far, and all of us are available free of cost, no conditions apply. And one last thing, you are aware of the fact that the Evergreen Club is now part of the Seniors Today family, so you can download that on your Android as well as Apple devices, and there are a host of activities which happen, as well as there are going to be training programs and workshops that will be part of this. And perhaps at that time we can collaborate with the Chelarams Institute and other medical institutions for just having these eye camps, or rather eye advisory sessions, which are always available for our viewers. Because as you could see, Doctor, there are so many questions that have come in. We've not been able to take, I can see there are 14 questions
Yes,
that I've not been able to take. And it's just such that there are, and whenever we have a doctor who is there for eyes, ENT, etc., there are so many questions that come in, and it's perhaps just a good idea for us to have these advisory videos, because and actually clarify a host of doubts that people have. Thank you very much, Dr.
Thank you
Bhat.
very much. It's been a pleasure to be here. Thank you so much.
Subscribe now and press the bell icon. Never miss an update.